Dr. Stan Yeatts. Today, I'd like to talk a moment about things that can change your life forever. That day when you realize your period is late and your pregnancy test is positive. I've seen that mix of excitement and anxiety countless times in my OB/GYN office over the last 30 years. It's not unusual for a patient to express, "I've never been so nervous checking my calendar before." The unknown can be intimidating, so I understand that feeling. Whether you're actively trying to conceive or this comes as a surprise, a missed period can feel like time stands still. Today I'm going to share about early pregnancy signs with special focus on that most telling indicator, a missed period. We'll cover what's normal, what's not, and when you should reach out to your healthcare provider. Let me start by explaining what's actually happening in your body during your menstrual cycle. The human body is an amazing part of creation. A normal menstrual cycle ranges from 21 to 35 days. Be aware that a missed period does not guarantee pregnancy. Most of the time, the missed menstrual cycle may have occurred because of a hormonal irregularity. I've seen many patients worry unnecessarily when other factors were at play. Common reasons for a delayed period include stress, significant weight change, intense exercise routines, medical conditions like PCOS or thyroid disease, some medications, or even perimenopause. When pregnancy does occur, your body starts producing a hormone known as human chorionic gonadotropin, or HCG, which we can detect in blood tests just 6 days after ovulation. Other hormones like progesterone and estrogen are produced at greater levels as a result of pregnancy and work together to maintain the pregnancy. The same hormones will suppress any further bleeding as a menstrual cycle. Let's talk about those early signs that might appear even before missed period. Some women are pregnant and experience implantation spotting, usually light pink or brown discharge that occurs around days 10 to 14 after conception. One of the most common early pregnancy symptoms is morning sickness. Despite its name, it can happen any time of the day. About 70% of pregnant women experience nausea or vomiting, typically starting between weeks 4 to 6. Other common early signs include breast tenderness. About 60% of women experience this one. Increased urination. Extreme fatigue thanks to the rising progesterone levels. Heightened sense of smell, mood changes, even food aversions or cravings. By week 5 to 6, about 60% of women feel some early pregnancy symptoms, and by week 8, that number jumps to 90%. If you're trying to conceive, it helps for you to understand your fertile window. Sperm can live for about 5 days, sometimes up to 7, while an egg is viable for about 12 to 24 hours after ovulation. This creates about a 6-day window of fertility each cycle. I recommend considering these methods for tracking your cycle. Record your basal body temperature every morning with a digital thermometer. Use Ovulation Predictor Kit for more precise ovulation tracking. Keep a detailed fertility diary of your moods, energy level, and physical sensations. Pay attention to changes in your cervical mucus. It also helps to recognize that when your cycle is irregular, if you experience irregular periods or anovulatory cycles, significant changes in menstrual flow or duration, vaginal spotting outside your regular period. Consult your women's healthcare provider as these problems may indicate a gynecologic issue that needs attention. Basal body temperature charting is a popular method of fertility tracking. During the follicular phase, basal body temperature will typically stay around 96 to 98 degrees Fahrenheit. However, once ovulation occurs, your basal body temperature will rise, usually between ½ degree to 1 degree Fahrenheit, and stay elevated for at least 3 days. It helps if you have a couple months of recording your temperature in this way to establish a trend. Your temperature chart will give you a visual representation of your cycle with possible ovulation. There will be hormonal fluctuations that cause ovulation. You can use this chart to approximate your ovulation date and take advantage of your fertile window in the subsequent month. Menstrual cycle irregularities and a late period have similar causes. If a couple desires to achieve pregnancy, here are some various factors that can interfere with ovulation: stress and anxiety, extreme changes in weight, thyroid disorders, polycystic ovarian syndrome. Understanding the causes and consequences of these irregularities can help you address them and improve your chances of conception. By making small changes to your daily routine and working with a women's healthcare provider, you can develop a personalized plan to support your reproductive health. If you're trying to get pregnant, here are some tips to increase your chances. Consider getting a routine gynecologic exam as a means to screen for other conditions that might interfere with your goal of pregnancy. Eat a balanced diet rich in produce, whole grains, and lean protein. Exercise regularly, but avoid excessive stress and fatigue if possible. Limit your caffeine intake during the 2-week window around ovulation. Consider incorporating supplements like folic acid and vitamin D into your diet. In recent years, technology has played a significant role in fertility tracking and conception. Some tools that can help you on your journey include fertility apps like Clarity or Kindara, which track your cycles, identify fertile windows, and provide personalized insight. Ovulation predictor kits like Peak Fertilities, which detect the LH surge. A basal body temperature device like a digital thermometer measures your temperature in seconds. Home pregnancy test devices like First Response or Clear Blue also can help determine pregnancy through urine testing. If you're experiencing any concerns with your reproductive health, here are some situations where it's best to consult a healthcare professional. For infertility, if you're younger than 35 years of age and have been trying to get pregnant for about a year without success, you should request a referral to a reproductive health specialist. If you're older than 35 years of age and have been trying to conceive for up to 6 months with no success, you should ask for that consultation. Pelvic pain. Persistent pelvic pain with intercourse on a regular basis should be evaluated. Endometriosis is a common and subtle condition that should be considered by your gynecologist. Abnormal uterine bleeding. Hormonal and anatomic abnormalities can create problems. Evaluation by your women's healthcare provider is necessary if the symptoms are frequent or worsening. Stay motivated and connected with this new chapter of life. Your body is being transformed to carry the amazing miracle of life inside. A balanced diet rich in whole fruits and vegetables provides essential nutrients for a healthy pregnancy. Key foods to focus on include oysters for selenium and zinc, berries for antioxidants and fiber, fatty fish for omega-3 fatty acids. Regular physical activity can boost your mood, improve circulation, and support hormone regulation. Aim for moderate intensity exercises like yoga for flexibility and stress relief, swimming for cardiovascular health, brisk walking for weight management. Stress management techniques can help your mood and overall well-being. Explore stress-reducing activities such as meditation or prayer for calmness, deep breathing exercises for relaxation, hobbies, sewing or drawing for creativity and expression. Understanding your body's cues is important. If your body is telling you that you're tired, then you should rest. Listen to your body and make significant difference in your fertility journey. By incorporating self-care practices into your daily routine, you'll be better equipped to balance your energy, manage stress, and nurture your reproductive health. In another video, Building a Support Network, we'll discuss the importance of seeking help and guidance from trusted resources, building a support network of loving family and friends, and advocating for your needs during the pregnancy journey. Surrounding yourself with people who understand and care and empathize can be a game changer during your journey to motherhood. Consider building relationships with others who share your experiences and perspectives. Moms in the Making, momsinthemaking.com, is a trustworthy group of women who offer support and encouragement because they've been there. Caregivers who offer emotional support and guidance. Friends who provide practical help and companionship. A missed period is just the beginning if it is the result of pregnancy. There's so much more to explore and learn about for your unique journey to motherhood. Pregnancy can be a challenging but rewarding journey. By understanding your body's signals, tracking your cycles, and staying informed about common challenges, you can increase your chances of conceiving and having a successful pregnancy. Don't forget to surround yourself with love, care, and strong support system. The dad, your family, friends, and healthcare providers will be instrumental in your journey. If you're trying to conceive, don't hesitate to reach out to your professional help. Consult your women's healthcare provider for cycle irregularities, fertility concerns, or other related issues. Your body is unique, so it's important to recognize that everyone has a different journey to motherhood. Please consider another Stork Advisor video, Preparing Your Body for Parenthood. There will delve into essential tips and insights on nutrition, exercise, stress management to support your overall well-being and boost your fertility. Visit our website, storkadvisor.com. We have free resources that may answer other questions and guide you during this process. Well, this is Dr. Stan. We've had a lot of information to cover today. I hope some of it has been helpful to you. Thank you for watching. See you next time.